I'm Rod Nordland, a correspondent for the New York Times in Kabul, Afghanistan. This young woman is Salima. She's a 19-year-old mother who is quite pregnant and has a small daughter who is suffering from acute malnutrition. She came here to the Indira Gandhi Pediatric Hospital in Kabul from her home in Logar province. Her daughter is malnourished and has a condition known as kwashiorkor, something most commonly associated with African famines. It's a condition where the child's hair turns orange and the belly distends. The condition can be reversible, and this child was probably caught in time. Much to our surprise, we've discovered that throughout Afghanistan, particularly in conflict areas, there is what doctors call acute severe malnutrition. So severe that the patient is in danger of dying. Most of the cases are seen in children under the age of 5.
تقریبا اگه ما بگوییم در ماه 200-300 مریض ما در این موسم در اینجا بستر میکنیم سوی تغذیه بستر میکنیم. تلفاتش شاید اگر با وقت برسه امکان داره که تلفات نداشته باشه، چرا که تداوی میشه. اگر داره شاید 5% نه 10% نه 250 نفر 5%ش بگیریم ما تلفات داریم.
It's a dramatically growing problem, especially prevalent in areas like Helmand and Kandahar. Although just how prevalent is a contentious and politically sensitive issue. When UNICEF issued a report saying that more than half of Afghan kids were malnourished, and as many as 17% in some provinces acutely malnourished, the government was infuriated, and UNICEF repudiated its own report. Such levels would indicate a serious health emergency. So now UNICEF and the Afghan government are cooperating in a new, more extensive survey. Judging from the experts and doctors we spoke to, that is also likely to show a very bad situation. Both healthcare workers and parents really don't understand why this is happening. It's not like there's a famine here. It's the result of bad health practices, dislocation because of war which is preventing people from getting to clinics, mothers who prefer formula to breastfeeding, formula made with tainted water. It doesn't seem to be because of insufficient food supplies. It's an extremely complex problem and one that does seem to be getting worse, not better. In the hospitals we visited, there was evidence of unexpected shortages in therapeutic foods, which are used to treat malnutrition. Specifically, 2 kinds of milk called F75 and F100, used for the youngest and most malnourished children. Then when kids get strong enough, a solid food called plumpy nut. UNICEF provides enough therapeutic food to reach 50,000 kids in hospitals around the country. Nonetheless, we kept finding places where there are shortages. UNICEF says this is due to supply chain issues, and they are working hard to fix the problem.
We work so hard, but we don't have good supply, good equipment or things. There is a lot of patients coming and they die.
This child's name is Ahmed Rashid. He's 2.5 years old. He comes from war-torn Ghazni province. During his 2 weeks at Indira Gandhi Hospital, he gained only a pound, from 12.3 to 13.3 pounds. But for a healthy boy his age, he should weigh more than twice that. In his case, his father has demanded that his mother bring him home because there's another child to care for. He may well not survive.
کلینیک که رفتم گفت تو چیزای خوب بخو که بخدا دل دشکم تو بگویی مرده باز که هم پیدا شد دیگه هم چیز نبود که جدا کردم هم چیز نبود دیگه دوستی تغذیه شد این که از گشنگی تا شده.
When you look through the wards at Indira Gandhi Hospital, you have to remember that this is the country's premier installation of its sort, the only pediatric hospital and one of the best hospitals. But you go in and see broken windows, oxygen from bottles on the floor, tubes connected to them with surgical tape, and this is the malnutrition intensive care unit. It's shockingly bad. For all the money spent on healthcare in Afghanistan during the past decade, you can't help but think, where did it all go?